Good morning, everyone. Welcome to our first webinar based on a series of research and evaluation projects supported by the Ministry of Health's Early Intervention and Innovation Fund program. The program was launched in 2017 and aims to build research capacity and raise the importance of evaluation within New South Wales NGOs providing alcohol and other drug services. Our thanks to NADA for co-hosting these webinars with us, and in the future we'll have NADA people presenting as well. My name is Fadil Petich and I'm the Manager of Strategic Research and Evaluation within the New South Wales Ministry of Health within the Centre of Alcohol and Other Drugs. Before we start, I'd like to acknowledge the traditional owners of the country where I'm working from today, the Gadigal people of the Eora Nation. I recognise their continuing connection to land, waters and culture. Always was, always will be Aboriginal land. I pay my respects to the elders past, present, emerging, and any Aboriginal people present in this webinar today. Now, our first speaker, we're very excited to have with us Associate Professor Peter Kelly, who's based at the School of Psychology, University of Wollongong. Peter is a registered clinical psychologist, has extensive clinical and research experience working with individuals diagnosed with severe mental illness and substance abuse problems. Much of Peter's research is focused on the development, implementation and evaluation of evidence-based approaches within substance dependence treatment settings. Today, Peter will be presenting on a research project funded by the Ministry of Health's grant program, the title of which is Client-Directed Care and Evaluation of the New Client-Centered Care Model used at Kedesh Rehabilitation Services. If you have questions during the webinar, please post them on the message board, on the Q&A board, and we'll attend to those as we go and or at the end of Peter's presentation. Thanks very much, everyone, and over to you, Pete.
Thank you for that introduction, and yeah, thank you so much for inviting me along and presenting today. I'll just share my screen really quickly. Yeah, so look, my name is Pete. I'm from the University of Wollongong, and today I'm presenting on behalf of our research group, who conducted, I think, a pretty interesting study with Kedesh Rehabilitation Services, looking at their new model of client-directed care. All research is conducted as part of a group, and would really like to acknowledge the rest of the team. So the Kedesh team, Mark and Danielle. This is a project that Kedesh led the application. They came up with the idea of it, and I think all the way through the process has been a really collaborative study. I've really appreciated working with them. Big thanks to the people from New South Wales Health, David and Sarah, who are really valuable and gave lots of input and feedback into the project. Big thanks to Frank Deane, who I know is on the line, who's one of the collaborators and a really good person to work with. I'll talk about Kate Hinsley's work as we go through this presentation, but she made some large contributions, and really want to acknowledge the work of Esther Davis. She was the lead project coordinator for this study and just did an absolutely outstanding job and led the systematic review that was conducted. So big thank you to everyone that was involved. Just to echo similar sentiments, I'd really like to acknowledge we're meeting on Aboriginal land today. We'd like to recognise Aboriginal elders, past, present, emerging, and just really warmly welcome any Aboriginal people that might be dialing into this webcast today. Just a couple more acknowledgements, and I promise I'll start the presentation. So once again, a big thanks to Kedesh. They've been really actively involved in this project and have been great partners. Big thanks to all of the staff. And would really like to thank the funders, the Ministry of Health. So the project that I'm going to be presenting on today is one of the NGO evaluation grants. And this type of funding scheme, I just think, is so important for health services in New South Wales. It provides money to evaluate different types of approaches or interventions that are already currently being included as part of routine care. But it gives us a chance to showcase that work, to critically evaluate it, to improve it, and to help disseminate it. And I know obviously times are tough with funding and lots of bigger health issues happening in the world at the moment, but it would be great to see some schemes like this continue in the future. I know there's a series of webinars coming up focused on some of these projects, and I think you're going to see a lot of just creative and interesting and really groundbreaking work. So thanks to the ministry. This was a really nice scheme. So let's start with Kedesh. So probably most people are familiar with it, but Kedesh is a really long-standing provider of alcohol and other drug services. So it started in the Illawarra and it's been in operation since about 1977. It's currently got two main sites. So there's a site down here in Berkeley, which is just outside of Wollongong, and there's the Phoenix unit at Mona Vale. I think historically Kedesh has been a pretty progressive organisation and has been trying to be at sort of the cutting edge of evidence-based practice in the field of drug and alcohol treatment. Traditionally, the residential program, and my presentation is really going to focus on the residential program down here in Wollongong, so Kedesh Rehabilitation Services. It's been a pretty standard residential program. So traditionally, it's been an 8-week program, a cognitive behavioural therapy, CBT type model. People would come in, they would do a pretty set program, they would progress from that. They get a cake at the end and they graduate from the program. And there was individual counselling and a bit of case management. And I think really to Mark Buckingham's credit and the broader Kedesh staff, there was an idea that I guess reflecting on the program and thinking, okay, we've been doing this for a period of time now. How can we improve our service delivery? There's been an increasing buzz or increasing noise around this idea around a client-centered care model, and Kedesh have really embraced that. So since about 2016, they have just been reviewing and reflecting and thinking about how they deliver residential drug and alcohol treatment, and have transitioned to a model of client-centered care. So that's really led to the current presentation. So the current study was really focused on an evaluation of the Kedesh client-centered care model. So evaluating that, seeing what's working, what's not working, see if it's actually has been implemented with the idea of just continuing to improve practice at Kedesh. As part of the presentation today, I'll go through our program of research. Not necessarily sure I'm going to do any of these aspects justice. So if you'd like copies of any of the papers, feel free to leave questions, and I'm no doubt that the Kedesh staff and likewise myself very happy to follow up after the presentation if there's anything else you'd like to know, if there's questions unanswered. So just start really broadly with this concept of client-centered care. And it's often called a few different things. So patient-centered care, I think, is how it's most widely reported in the literature, often in sort of medical type settings. Person-centered care is another term that's often used. And it's an approach to care that's advocated by pretty much all of the leading health authorities throughout the world. So New South Wales Health, World Health Organization, ICHOM, ACI, et cetera, et cetera. It's an approach that I think universally agreed on of this idea of responding to individual needs and being really responsive to people as unique people and considering their preferences, needs, values, and really providing clients or patients or people with opportunities to, I guess, reflect and be involved and contribute to their own treatment. So it's one way to think of it, and stereotyping here a little bit, but if you think about traditional medical models, often it's a one-size-fits-all approach. So someone's got this problem, so they get this type of treatment, and everyone tends to get the same type of treatment for the same type of kind of disease. Whereas a client-centered care model is much more individually focused. So it's really considering the unique needs of individuals and thinking about how we might be able to engage, provide choice to individuals and for them to have a bit more autonomy over the overall treatment process. If you think about a residential setting and delivering client-centered care, it's challenging. And I think when you look at some of the results of the study, you'll see it's not the simplest thing in the world. If you're working on a one-on-one setting, it's much easier to be responsive and reflective to the person that's sitting in front of you. But if you're working in a residential facility, you may not have a lot of staff members on the floor, and you're trying to provide care that's really unique to individuals. There are some challenges and some complexities. And that's what I was really, I guess, most interested in this study, just seeing if it's actually happening at Kedesh. So we didn't necessarily start the project with the idea of wanting to do a systematic review, but to really get our heads into the area and really understand what's happening. We started to do a literature search and then realized that a systematic review hadn't been completed in the field. So we took a snap at it, and we had a go at doing a systematic review, and Esther did a great job at leading this research. The short summary of it is there's not a lot of work in the field. There's about 25 articles that have looked at the relationship between patient-centered care and outcomes in the drug and alcohol field. Results with such a small number of studies are a little inconsistent, but there's a general sort of small consistent trend between treatment approaches or services that are more client-centered care, participants having better outcomes, which is positive. I guess as a side note, you would hope that client-centered care results in greater client improvement. But really another important aspect is just the ethical side of it. I think if any of us are thinking about our own healthcare, I think we all like the idea that we're presented with options, that we're informed, that we can make choices, that things are tailored to us. So I think there's a sort of an ethical aspect as well. But I digress. The research that has been conducted looking at patient-centered care has largely focused on satisfaction, and there's just a dearth of studies that have looked at patient-reported experience measures. Just briefly, and maybe people are familiar with this idea already, but satisfaction measures, which I think we're all pretty familiar with, tend to measure a feeling, sort of an effective response to healthcare. So they tend to ask questions like, would you recommend this to a friend? What was your overall experience? How satisfied were you with care? Those types of questions, really valuable, really important, and should absolutely be included as part of good quality care. However, they don't get at the nuts and bolts of what's actually happening as part of treatment. Experience measures tend to measure more factual aspects of treatment. Did this happen? Did this procedure happen? Were you supported in this way? Were you given a choice, et cetera, et cetera? So the idea of measuring experience provides, I guess, a more factual account of what happened in treatment, and subsequently gives you an opportunity to improve your service and think about, routine quality improvement based on those results. And I'll try and come back to that issue in a second. So to conduct this study, we were interested in, I guess, looking at the experience of Kedesh clients who are going through Kedesh. And this is an aspect of the project that wasn't necessarily funded through health or part of our original grant. It was just, it just happened. It was good timing. We had a student who was studying and doing a clinical master's, Kate Hinsley, who was really interested in this idea of, what is the experience? What do people appreciate? What don't they appreciate with attending drug and alcohol treatment? She did a really nice study. She went out and did focus groups with people accessing drug and alcohol services across 5 different services, so including Kedesh, but with other services. Largely residential services. There was an outpatient service, but I think this work lends itself most closely to residential services. So she did these interviews and then went away and developed some draft questionnaires, then took that back out, showed people who are accessing drug and alcohol services, showed experienced drug and alcohol workers, and got their feedback, and ultimately published a draft version of what we call the PreMATT. And it's available in Drug and Alcohol Review. And if you'd like a copy of that paper, just let us know and we can absolutely send it through to you. I think what's interesting in that paper is that it provides a really nice description of what people value and what they really care about when they're accessing treatment in this state. So we've extended that work. We subsequently work with the Salvation Army and got all of their participants to complete it over a period of time. And we're doing some sort of psychometric evaluation of that. We still haven't had it peer reviewed, but we're hoping to submit that work really soon. And yeah, happy to share that once it's ready. So just wanted to jump now into the specific evaluation that we did with Kedesh Rehabilitation Services. And really it was guided by 3 research questions. So is Kedesh delivering a model consistent with client care? I should say Kedesh holds a soft spot in my heart. When I graduated, when I finished sort of my undergraduate studies and was just trying to work out what I would do or how I would contribute to this world, I had a lecturer by the name of Jessica Granger who suggested that I volunteer at Kedesh Rehabilitation Services and just try and get some experience working in the drug and alcohol sector. And it's a place where I developed my clinical skills and sort of understanding of the field. I can also say, I don't think we were that client-centered back in the day. We had a very big rule book and there were very sort of set procedures and set policies. And I think I was a little skeptical when Mark was talking about the client-centered care. I was just particularly interested to see if it's actually happening as part of the service. Other aspects we're interested in, we're looking at the overall sort of client value. Like, do they appreciate this experience, this new model? And likewise, trying to hear from staff members about what their perspective were on this new model. This required us to use a mixed methods approach. So we did some quantitative analysis, and I'll talk to this, but I think this type of study really lends itself more to the qualitative analysis. Really interested in is something happening and can it be described? And I think the qualitative results tend to highlight it the most. But in terms of the quantitative aspects with the study, we went through and we did a longitudinal follow-up of people who are accessing Kedesh, and we did sort of baseline, week 4, week 7, and 1 month follow-up assessments. We used the NADA base, which Kedesh is already using. We used the SURE, the Substance Use Recovery Evaluator. Then we used a couple of measures of satisfaction and experience, including the one that we developed, the PreMATT. In terms of the results, probably not that surprising. People at Kedesh improve. So as people are moving through treatment, they're improving on each of the outcome measures as they're going through. And that's what you would hope, and that's what you would absolutely expect for a service that's been in operation for so long and it has a really good sense of what they're doing. In terms of client experience, what we were hoping for, and it was a little difficult to think about hypotheses in this area, but we're hoping for it to be kind of consistently high across treatment. I don't think there was necessarily a logic that it would improve, or you would hope that it wouldn't get worse, but that it would be kind of consistently high. My apologies for this slide. I know it's a bit messy and there's lots of numbers, but this is the PreMATT and this is the different subscales on the PreMATT. And it's really the red things to highlight here that, across at week 4 and at week 7, people who are accessing Kedesh reported, pretty high levels of positive experience associated with the program. And likewise, consistent scores across the satisfaction measure. And you can see that all of it's quite consistent, that people are quite satisfied and quite value the experience across the treatment process. I won't labor on this one too much. This is probably more of interest to the Kedesh staff and the Kedesh team, but this is the PreMATT, the experience measure that we use. And this just highlights the top 5 items and then the lowest 5 items rated for Kedesh. And I guess I'm just highlighting this because using experience measures and having really specific questions, like I have enough one-to-one sessions, or I am provided with fruit and vegetables, they're very specific, very concrete questions. And if people are rating them quite high, you know that there's a good supply of fresh fruit and veg. But if people are rating things quite low, so for example, my family and friends have been provided with information about recovery, it suggests areas for improvement. It suggests things that should be flagged in staff meetings and discussed with participants and their carers and families and thinking about how things could be improved. And just to reiterate, these items, these are the things that people accessing residential drug and alcohol services said that they really, really valued. So I think this information is particularly helpful to improve services. So I'll now move on to the qualitative results. So we did 4 client focus groups, so about 18 clients, and we got to a stage where we just didn't need to do any more focus groups. We were getting saturation, we were getting sort of similar results across those interviews. Did individual interviews with staff members and then did some thematic analysis. This first slide highlights the core themes of client-centered care. So this was asking the staff members, describe to us what this client-centered care model is. How is it being implemented? What does it look like? Like, can you articulate it to us? And what they described to us was, one of the first themes was flexible. So it's this idea that treatment is flexible for individual needs, and there's flexibility around things that were often quite rule-driven in residential rehab, around sort of extensions and re-entry and length of stay and leave. I know that often there's a little bit of flexibility around those types of rules, whereas Kedesh have tried to be really flexible and really tailored to the individual. They can do a better job of explaining this. There's a sense of being comprehensive, so being really focused on the holistic needs of individuals who are accessing treatment, so thinking really kind of holistically. And the sense you get from staff is that treatment is much more comprehensive when you can do that. It's a sense of sort of being open-minded. So if you sort of throw out the playbook, you throw out the rule book around how things must work, there's this sort of idea of being kind of creative and critically thinking about what you're doing, and is that therapeutic, and is that in the best interests of the individual client. And then likewise, there's an aspect of being inclusive, actually providing people that you're working with choice, information about different treatment options, information around different pathways they might be able to take, and giving them opportunities to discuss that. Across all of the interviews with staff and management, just really consistent themes coming through. Then this slide is focused on benefits and challenges. So this is what we drew from interviews with clients and staff, and you can see where it's got a C next to something that's specifically coming from a client or a participant. So we're interested in looking at what the benefits and challenges were with the client-centered model, and they grouped around these similar themes. I won't go through all of this in detail, but some of the benefits are just this idea of like an individualized care, and participants really appreciated choice. The challenge is around consistency. So someone gets one rule, someone else gets another rule. What does that mean, and how do you do that in a setting where people are living together? And so staff found that challenging, and likewise, often clients would just kind of felt a bit of sort of push and pull in relation to that. Around comprehensive care, I think the point from the clients here really captures it. It's this idea that all of their needs are being met. It's not just a focus on the drug and alcohol, and it's not just a focus on getting through the program. It's a much broader focus, depending on what that person's individual needs are. But what comes with that is a level of complexity. It's challenging, and it's difficult for staff to be able to logistically address everyone's needs. In terms of the open-mindedness, clients really appreciated having choice and being involved in those discussions, and just sort of having greater agency. And I think staff like the creative aspect of the project, of the process, being able to come up with creative solutions to what might be presented rather than just following the rules. But what came with that is it's resource intensive. And so at a service that doesn't have a lot of staff members on the floor, it becomes tricky. And likewise, there's some uncertainty for clients who maybe haven't been involved in making decisions before. And I think we all struggle with making different health decisions and different health choices at different stages. When that's sort of put back onto you, it can be a little confronting and a little tricky. And then lastly, around sort of the inclusive nature of it, I really like this quote from the staff member. Staff get that genuine sense of doing what's best for the individual. And I know I absolutely had the experience working at Kedesh in a residential facility where you're sort of following the rules, but it just didn't feel like the right thing to do. Whereas here, within this new model, there's a chance to reflect and a chance to adapt those rules, and participants really appreciated the sense of compassion. So in conclusion, I'm pretty much done. Well, Kedesh has done a great job at implementing the client-centered care model. There's absolutely clear evidence that it's being delivered and implemented at Kedesh, and that came through strongly through the interview. It's a work in progress. And so I think if you spoke to staff at Kedesh, they would say, look, we're here and we still want to improve. And there's areas that we still need to improve in and reflect and refine procedures, but they're well down the path. And there's really clear evidence that it's being implemented. In terms of future directions, I've tried to highlight maybe some future directions for the sector. This has been a huge learning process for Kedesh to go through. And I think if there's other drug and alcohol services, NGO sector, but also in New South Wales Health, who are thinking about moving towards a more client-centered care model, having some sort of documentation, some guidelines, some procedures, I think might speed up that process for lots of services, and can learn from the experiences of places like Kedesh who've been doing it. So I think that would be an interesting thing to think about, and maybe it could be led by the ministry or NADA, but yeah, I think would be great to involve Kedesh in something like that. And then there's a level of extra care associated with client-centered care. So thinking about staffing levels in NGOs is important. Measuring experience and satisfaction throughout the treatment process. I think we're all in agreement that that's an important thing to do. Just to add to that, we got the most interesting information and the most valuable information from the interviews that we did with participants. That's where we got the most useful description. So when people are thinking about evaluating client-centered care at your services, measures and questionnaires are good, but actually talking to people I think is particularly useful. So I'll end it there. Thank you so much for listening, and yeah, happy to answer a couple of questions. Likewise, we've got Mark on the line who could answer some as well. Thanks, Fidel.
Thanks very much, Pete. Great presentation. Thank you so much. And obviously well aligned with new directions in terms of consumer-focused outcomes as well. And as you say, an opportunity to sit down and talk to people face to face. There's no replacement for that. There's only so far a tick a box survey can take you. I can see that we did have a couple of questions from Alison Beck. That's three things have been raised by Alison, but she feels like that's been addressed anyway. Mark, I just wonder if we've got a couple of minutes left, if you wanted to make any comments in terms of it's meant for Kedesh post the research.
Certainly. Look, thank you. Thanks, Fidel, and thanks everybody for joining in on this today and the interest. And thank you, Pete, for giving such a comprehensive overview of the work that we've been doing. I think in terms of direction for Kedesh, there is absolutely no turning back in terms of pursuing and making the client-centered approach, forefront in what we're doing. We've recently had strategic planning days prior to COVID, and as a result of the research and the experience, we've revised vision statements and so forth that are more reflective of a client-centered approach. That's our commitment. It's funny this morning, and again, even hearing through the presentation that, I'm so proud of those achievements, but where we're at now, we feel we've progressed even further from when this evaluation wrapped up in terms of what we're doing with client-centered approach. COVID, as hard and challenging as that's been, has actually given Kedesh the opportunity to not only take things into an online platform, but demonstrated to us that putting more work into a client in what I often jovially refer to as the prehab stage prior to getting into rehab, the more work we can do with a client more intensively and start care planning with a client there, that impacts significantly what their residential episode will be. And by dismantling, if you like, the 8-week, or I think it was actually, going back to when I started at Kedesh 16 years ago, I think it was about a 12 to 16 week program then. We've just started onboarding clients this week back into residential here in Wollongong, and they're not coming in with the driver, if you like, being the prescribed 8 to 10 week program that we believe has obviously got benefit in terms of the content, but we're not forcing that individual through it at that pace that we say is 8 weeks. Pete certainly alluded, going back to his days, where we see clients in here at times and you think, you know, the intensity's not right here. They need less of this or more of that, you know. And because you're still trying to run everything against the backdrop of a fixed model, it just, you know, the program gets in the way of what you really want to be doing with the client. Yeah.
Great. Thanks so much, Mark. Pete, I think there's one question that you wanted to answer live, and I'm not sure if we'll be kicked off soon. Zoom has a limit.
Yeah, so someone just sent through a query about getting access to papers and whatnot. So I just put my email address in the comments. Anyone's welcome to shoot me an email and we can send you through any of that. We're really happy to share it, or talk to people as well.
Yeah, equally, of course, we are as well. We're happy to share anything that we've developed. We've obviously done significant policy review and procedure review. You know, you talk about the rules or the responses, interventions, whatever you want to call them, that, you know, we all address day to day within the confines of a res setting. We've rewritten a lot of that to reflect our approach now. You know, right down to, you know, discharging policies, for example, things like that. And we're happy to have any of you over here anytime.
Fantastic. Thank you so much, Mark. And thanks, Pete. Once again, much appreciated. Thank you for attending the webinar today. We'll look forward to seeing you again in 3 weeks, Friday, the 21st of August, where we'll have 2 presentations, one from Odyssey House on New South Wales Resi Rehab Program Evaluation, and also from Ted Knopf's on their Foundation Street University. So that's 10 to 11, Friday the 21st. Look forward to seeing you then. And thanks for everyone today, and have a great weekend.
Thank you, everyone. Thank you. Bye-bye.